Today's episode revolves around Pride, and we were lucky enough to interview some of the members of the Gender Care Clinic out of the SMC Medical Center. So we really hope that you enjoyed this interview, and with that out of the way, I'll go ahead and let them introduce themselves. Bye.
My name is Brendan Scher. I am a psychiatrist. I have a couple of different roles. I have been with the county in 18 days, it'll be 24 years. And I came through a psychiatry residency here, and now I am the residency program director. So I help to usher our newly graduated physicians from finishing medical school into being attending physicians. I also am a staff psychiatrist at the Central County Behavioral Health and Recovery Services. And then my most recent job is being the psychiatrist and one of the mental health providers for the Gender Care Clinic at San Mateo Medical Center, where I assist the team and talk with psychology about how best to help support our clients.
So my name is Sonia Turkile. I am a family physician by training, and I am working as a supervising physician at the Innovative Care Clinic, which is one of our adult primary care clinics in the county. And then for the last 5 or 6 years, I've been working with the Gender Care Clinic as well, in a role working with patients who are interested in hormonal therapy, working with the patients towards their gender care goal.
I'm Chris Thibodeau. I'm a social work supervisor at the Edison Clinic, and I work in our HIV care system, but I've also been blessed with working with the Gender Care Clinic, our gender care system at the San Mateo Medical Center since it looks like 2016, so coming up on 8 years. I helped plan that clinic as well. I got invited accidentally and fortuitously to that clinic and got to enjoy helping just create that system a little bit. It's a multidisciplinary team where we help people who are trans, non-binary, just otherwise gender non-conforming, with treatments, support services, access to things that might help them affirm their gender and just feel right and look right and be right in their authentic gender experience and presentation. I do the social work for that clinic and enjoy collaborating with our team very much.
June is Pride Month. As we all know, we just had an amazing Pride celebration over at the Central Park in San Mateo. So, quick question, how does the clinic celebrate Pride?
You know, one of the things that we do is we encourage the folks that we take care of in our clinic to find and forge community. Folks who are trans and non-binary, one of the things we know is that it can be hard for them to find community in the world that we live in. And so what we do in our clinic is share with our patients information that Pride is coming. We encourage them to attend for sure. I spoke with someone just right before San Mateo Pride last week and encouraged her to come by. She's a patient who Sonia would recall helped us with one of our trainings that we actually did for the medical center, and we had 2 of our amazing patients from Gender Care come and help us with that training, actually, and she's one of them, and she was going to plan to go by Pride this last weekend. So for one of the things we do is just promote it as a place for people to seek out and find community, and we invite folks to go. Some of us as providers have gone to Pride in San Mateo and sometimes actually in Half Moon Bay, for example, on the coast. An example of this is I talked with someone the other day at Pride who told me that non-binary wasn't quite the right gender for them, but it was kind of on the right track. In other words, it was sort of in an area of the non-binary, but the experiences they had heard about were not quite right for them. And so I got to share about our clinic and ask that person to check in with me. So what we've noticed at events like Pride is that people come and share their experiences, but they also sort of continue to create space and language for how gender as a topic is expanding just in our world and our communities, but it also helps folks like us, like providers, form our abilities to take care of them.
Well-rounded answer. Loved all of them. So Brendan, the Gender Care Clinic is such a great resource for the queer community. Can you describe some reasons why it's such an important thing to have in our system?
The one thing that I reflect on here, especially any time that I work with the gender care clinic right now, is just the tremendous change that's happened in San Mateo and in the discourse and treatment of this. So I think the first time that I started doing gender evaluations was 2003. And the regulations and the rules and the ideas were all much less refined and much less patient-centered than they are now. And the idea at the time, we had the Edison Clinic, which was an amazing resource for people with HIV and other issues. But all queer care, queer treatment, the idea really was go to San Francisco. We're so close to San Francisco, just go to San Francisco. That was really what I feel like. They were like, there's a Pride Center, that had just go there. It took a long time, I think, and a lot of leadership and a lot of people talking about it to really realize that that was actually really insufficient and that it was dismissive of the queer population here in San Mateo, that it wasn't welcoming. We have a Pride Center in San Mateo. We have a Coastside Pride Center. We have a gender care clinic. This incredible sea change with regard to who should be providing care, with the recognition that it's us, who should be receiving care, which is the recognition that it should be everyone, and who should be in charge of that care, which is really recognizing that it should be, as much as is safe and knowledgeable, like patient-centered and patient-driven. I think all of the queer people in this community who live here, work here, take care of each other, take care of their partners, even if they're not going to Pride, even if they're not going to the center, even if they're not interacting with any of that, seeing it around, seeing that it's here, is a real recognition that queer people are a valued part of the community, need to be a part of the community, and should receive, all the rights and privileges of all our other citizens.
Thank you so much for not only just the historical context, but also bringing it back to accountability. It's not an accountable process for us to send people to a resource and then possibly overburden that resource. We should build in those systems within our own organization as well. So thank you for bringing that up. In your time in working with the trans and gender nonconforming community, are there certain things that you've learned? Are there certain things that you've improved on, your understanding, or certain ways you handle situations, or even just the vernacular that you use?
Totally. I mean, I think one of the wonderful things about being a provider who does work with patients in the trans community and in the non-binary community, or the patients who are seeking gender-affirming care, is that really it's really about what they want and what they they're guiding the way in a way that's much different than from what we do in other parts of medicine, where we're more often saying, this is what I think you need to do about your medical problem. And so I think what I have learned is mostly around listening more carefully to what the patient is desiring and trying to really understand what are the pieces that will help them along the way. And sometimes that takes, listening with an eye to things that I might know we have as resources that they may not know that we have. And also recognizing that, I may have some insights that they may not have in terms of like what some of the treatments may bring them, but also some of the negative side effects or some of the things that may happen along the way, and knowing the breadth of experience of the different patients that I've worked with can help them. But I think that really trying to understand what their goals are and really letting them lead the way is kind of a different approach than what we often get taught in medical training. You get to witness a lot of courage and a lot of often very deep introspection about what their goals are and what they want.
The team over at What the Heck would like to extend a huge gratitude towards the Gender Care Clinic members who were able to be in this video. We aren't able to share everything that we were able to film, but we hope that with this small glimpse into their world that you have more resources to share with anyone that you are helping. So thank you for watching, and we'll see you again on the next episode of What the Heck.